The Howard County Health Assessment Survey is a biennial study commissioned by partners to assess health-related behaviors and risk factors among the adult population of Howard County. The results allow local government, health providers, and stakeholders to measure progress and determine where to focus resources to improve outcomes and make the community healthier. More information about the survey can be found online at www.howardcountyhealthsurvey.com. Howard County is a fairly healthy county. However, significant challenges still exist. The majority of the county has some form of health care coverage. However, more than 15,000 residents, or 5% of the population, do not. 13%, or roughly 30,000 county residents, report not having a regular primary care provider, and about 8% of residents have sought care in an emergency room when they could not get a doctor's appointment. With regard to preventative testing, Howard County does well, with more than 80% of women over 40 having reported having had a mammogram in the past 2 years. However, only 61% of residents over age 50 have had a colonoscopy or sigmoidoscopy within the past 5 years as recommended. Almost half of all residents who did not see a dentist in the past year stated the reason was due to cost. The survey included questions about many chronic diseases, including cancer, heart disease, stroke, and diabetes. Slightly more than 1/4, or 26% of residents, have been told by a health professional that they have high blood pressure. Of those who have been told they have high blood pressure, 75% are currently taking medications to control it. Diabetes continues to be a concern for many residents. Although numbers have improved slightly since 2014, 7% of residents are diabetic. Another 7% are also pre-diabetic or borderline diabetic. 24% of residents were diagnosed with diabetes before age 40 and 32% between age 50 and 59, both higher percentages when compared to 2014. 60% of respondents reported BMI scores in the overweight or obese range, compared with 65% of Marylanders. Approximately 15% of residents report eating three or more servings of fruits or vegetables a day, and roughly 65% have at least one serving, although at least 5 per day is recommended. However, when broken down by income, more than 40% of residents earning less than $50,000 annually are getting less than one serving of fruit or vegetables per day. Women were more likely than men to report taking medication or receiving treatment from a doctor or other health professional for a mental or emotional condition. In 2016, about 28% of residents reported being sometimes, usually, or always stressed about money for vital expenses such as rent, mortgage, and food. However, respondents who identified their race as African American, Hispanic, or other were more likely to experience this type of stress. 28% of Howard County residents have smoked at least 100 cigarettes in their life, slightly less than the 29% reported in 2014. 8% of residents who have smoked at least 100 cigarettes in their life currently smoke every day or some days, a marked decrease from the 26% measured in 2014 and 29% in 2012. 98% of residents aged 55 or older have health care coverage, and 88% have a personal health care provider. More than 70% of residents in this age group with chronic conditions such as high blood pressure or high cholesterol are using medication to control it. Older Howard County residents are also less likely to smoke cigarettes, with less than 4% of residents aged 55 or older smoking every day. 44% of households in Howard County have children, with the greatest percentages being in Laurel and Elkridge. Health conditions also exist amongst the youth population, with 20% having asthma and 11% suffering from anxiety or depression. A new question asked in 2016 revealed that 77% of women breastfed their youngest child. Insurance coverage has held fairly steady since 2012, with the majority of the population having some form of coverage. However, there has been an increase in residents without a primary care provider. Concerns about money for vital expenses like rent and food showed an increase in the Ellicott City and Laurel planning districts. The percentage of residents reporting being either overweight or obese has increased in African American, Asian, and Hispanic populations as compared to 2014, illustrating a regression towards 2012 levels. These trend snapshots illustrate 2012, 2014, and 2016 responses for a few of the primary concerns in Howard County. While healthcare coverage has remained fairly consistent, there has been a slight increase year to year for emergency room utilization. Also, the percentage of residents seeking care for behavioral health conditions has increased. This information in the presentation and more may be found online at www.howardcountyhealthsurvey.com. For questions or more detailed information, please contact Kelly Kessler, Director of the Howard County Local Health Improvement Coalition, or Felicia Palin, Director of Policy Planning and Communications with the Howard County Health Department. Thank you for participating.